It was quick today.
Oh, usually it takes forever.
Mm-hmm.
I apologize if you guys hear the construction workers that just started outside my house like 2 seconds ago. So that's great timing. So, all right, we'll go ahead and get started. Thank you everyone for hopping on. Go ahead. Oh, before we get started, is there anyone on the phone that isn't able to type their name into the chat? Everyone who's logged in and has a name, we have the attendance tracker on, so it'll capture you. But if you're just calling in, then it will just show your phone number. So let me know so I can get your name on the roll. Is there anyone just on the phone? Okay. All right. So meetings from last minutes is I was going to follow up on some EMS triage criteria clarification with ACS. And I apologize, I have not gotten that clarification. It's been a very busy few months and I've had a hard time getting in contact with someone who has the info that we need. So I will start working, or I will keep working on that, and we'll hopefully have an answer for you guys by next meeting. And if it's not sooner, then I'll just send it out so you don't have to wait until January. Okay. Okay, just a reminder, next data submission is due January 2nd. It's not due on the 1st because that's a holiday. Make sure and submit your data by the due date, and make sure you have all corrections in within 15 days of receiving them. So we already have gone over the rules. You have 15 days to make the corrections. And I've been emailing you guys. So if you're getting emails, it's not because you're not submitting it or it's not on time. Usually it's everyone's getting those emails, and you guys have been doing fantastic at getting your data in on time. The percentage of facilities that have submitted their data on time is much higher with all of those reminder emails. So that's why you can be expecting those. Let's see. Okay, so I wanted to go over some of the changes from NTDB. As you guys know, we don't adopt all of the changes. So if you guys have seen the list, they've added a couple of new variables, new data elements that we don't adopt because our data elements are written into rule. But the data elements that we do capture, that they have, that they update their pick list, we do capture those. So these are the ones that are applicable to us. This is not all of them. It's just the ones applicable to the state. So for those of you who are TQIP facilities, submit data, you'll have, there were only 1 or 2 new data elements that you'll capture. So the changes you'll see are for ED discharge disposition. They changed it to say operating room, or parentheses, hybrid OR. And then they also added an interventional radiology suite option, which is exciting because I know that's something we've kind of wanted. And then they also added hospice, and then hospice facility, hospice unit, home hospice. So those are all for ED discharge disposition options. And then there's a couple of new pre-existing conditions. They added autism spectrum disorder, or ASD. They've also added bronchopulmonary dysplasia, or chronic lung disease. And we're not going to go over all of the definitions because those are in the NTDB data dictionary. But they are just like all the others where there are specific definitions for what they capture. And then they've also added ventilator dependence. So those are the 3 new pre-existing conditions, and you're only going to start capturing these and seeing these changes starting January 1st, 2025. So I will make the pick list updates at that time. I'm just letting you know now, so it's we don't meet again until the middle of January, so I don't want to spring those on. Any questions on those? Okay. Botsel, do we have you on the line?
Yes.
Awesome. So I'm going to turn some time over to Voxel. We've talked about Quail Kids a little bit in the past. It's an ATV injury prevention program we've kind of worked with some facilities and Game and Fish Department on. And Voxel has a report that we're going to share with you guys just so you kind of can see how it's gone and kind of pass that along maybe to your trauma program managers or people, your injury prevention coordinators, to see if you could implement that in your community. So Voxel, do you want me to turn the screen over to you as well?
Yes, please. Thank you, Vanessa.
And for those of you who may be new, who don't know VOTS, she is fantastic and puts together all of our dashboards and our annual reports, and basically makes use of all of your fantastic data you collect. So.
All right. Good morning, everyone, and thank you, Carissa, for the introduction. My name is Vatsal Chikhani, and I'm a biostatistician, come a lead research analyst for the Bureau of EMS and Trauma. Some of you guys have already heard about me talking about Queer Kids program at some other meetings, but for those who actually doesn't know anything about this program, I want to start with some introduction, some background, what this program is about. So let me actually start with the data, like, okay, what is the burden right now, of ATV or of highway vehicle injury? This is a dashboard available on our website. And the dashboard, there are 2 pages for the dashboard. The first page, it analyzes hospital discharge database and not just trauma registry. It's basically comes from the hospital discharge database in order to understand the actual magnitude of ATV injuries. And the second tab basically takes the data from the trauma registry. Now in trauma registry, we collect much detailed information than hospital discharge database, like helmet use or seatbelt use or alcohol and substance abuse and those kind of information. So the hospital data, it is just to give you demographics and the number of incidents happening in the state of Arizona. So what we observed is that after 2019, there was a jump in ATV injuries. That was our COVID year 2020, and then it kind of stayed in the on the upper side, compared to 2019. Like we had 4,000 cases, and we jumped to as high as 5,000, and now 4,000, almost 800 cases. So we are, there was a huge increase in ATV injuries happened in last 3 years. That kind of, started a discussion within the Bureau. Okay, what can we do? There is that we need to do something about ATV injuries, with whom we can collaborate with or partner with to figure out some kind of injury prevention programs. So what we observed in order to basically figure out an injury prevention program, first thing came to us is like, okay, let's dig up a little bit in detail and look at the demographics, look at what kind of education efforts we can do. Let's study this population a little bit more. So what we found out is that it's more among if we do the rates for 100,000 populations, white non-Hispanic is higher, followed by Hispanic. And then
are you showing a graph? Because we're not seeing a graph.
You're not seeing any graph?
No. We see the overview presentation, Google slide.
You mean I need to share
right.
it?
Yes, I know. Let me do this one more time. Hold on. Thank you for, me drawing that. Present something else. I have to share. Okay.
Yeah, we see it. Thank you.
Yeah. Okay. So as we see, as I say that that's a ethnicity distribution. Age and gender, what we see is that male and female kind of in this middle group, and that is from 10 to 14 to 35 to 44 years old, and almost similar distribution between male and female. We had 22 deaths occurred due to ATV last year, 2023. And where these are by county, the distributions is the darker the color, the more injury rate per 100,000. And what we see is that, again, some of our, these are all our rural counties have a very high rate of ATV injuries compared to our urban counties. Resulted into 169 million total charges with a median of $9,500 per patient. Yeah, that is just, we are talking about the hospital cost. We are not talking about patients then requiring long-term care, rehab, or the EMS coming on the scene and that cost. And obviously, then the people are not able to work during those days, and that's loss of work cost. If you see over here, 162 patients, like 3%, 3.5%, required some kind of a rehab, and 5% required transfer to higher level of care, with 22 deaths happening in it. What another interesting thing we found is that there is a population available, which is a pediatric population you can choose. And if we choose the pediatric population, just the race ethnicity kind of changes. And what we see is that instead of white, predominantly white, it is more among Hispanic population. And do you see that is more increase among pediatric compared to overall increase? I mean, there is not much difference between the last 2 years, whereas adult injury, adult injury has decreased a little bit in 2023 more compared to what we have seen in the pediatric injuries. I should. Now, let me go and talk about trauma. That this is our trauma registry. And what we have, obviously in the trauma registry, we are not gonna see that number of incidents, what we see in the hospital discharge database. This is only the people getting admitted or taken by the EMS trauma centers, right? So what we observed, we observed a similar pattern. If I look at the 2019, we are in the 1800 range, that jumped to 2200 in 2020, and then have stayed in kind of that and slightly declined in 2022. I think, we are almost getting ready for publishing 2023 data. Actually, I could have presented that dashboard. That dashboard is almost ready, but not available publicly. So, here what we have observed is, like, look at that, 66% of the population was not wearing helmet, only 32%. And there was 28% people, 28, almost quarter of them received head injury, not quarter, 1/3 of them. And if I do no helmet group, the head injury percent increases. Compared to the helmet group, only 16% got head injury, whereas in the no helmet group, 34% got head injury. So yes, helmet protects, but only 32% of people were wearing helmet who were involved in ATV injuries. Another thing, like a quarter of the patients had a suspected or confirmed alcohol or drug in the system, and it is mainly alcohol followed by marijuana is the substance we found. When there was toxicological tests were confirmed. Again, the age and gender is a similar pattern what we observed in the hospital discharge database. Also, it's kind of between 10 to 14 to slightly it stays still on 45 to 54 also, and male and female distribution is quite similar. In trauma registry, we observed 21 deaths. Again, almost all the deaths were at trauma center, which kind of makes sense that severe injuries are getting transferred to trauma center. So that's good. What we observed, I think, in hospital discharge, there were 22 deaths and 21 we found in trauma registry. So that is a good sign. And 8% were again transferred for a higher level of care. So that may be from level 4 to level 3 or level 2 or level 1 we are talking about. And 4% required rehab or transfer discharge to skilled nursing facility or long-term care or rehab or some kind of aftercare. What else is that, 44% gets admitted to the hospital. So these injuries are kind of little severe, like almost 45% required admission to the hospital. And then the 10% require that they were admitted to the ICU with a median length of stay was 2 days. So this kind of tells us that it's quite a significant burden ATV injuries is playing in Arizona. And because it is now on the increasing level, there is something needs to be done about that injury. So now I'm going to go back to my PowerPoint presentation. Let me change the screen again. So what we did is that we talked to the Arizona Game and Fish Department came into our mind, and we started talking with them, like what they are doing in terms of preventing these injuries. You know, these are basically comes under the Game and Fish Department. You know, it's more of an entertainment kind of recreational injuries, right? So they already have a curriculum. Quail Kids is a curriculum, and they were very happy to partner with us to spread the awareness about ATV injuries and educate the community, you know, what can be done to prevent these kind of injuries or what precautions you need to take. So that curriculum was already in place. And we presented this kind of an idea at the Trauma Program Managers Work Group, and people showed interest. You guys showed interest, you know, all the level 4 trauma centers say they would like to take this curriculum and implement in their community to increase awareness among school kids. That's how this whole program emerged from there. And so our first pilot program was implemented in August 2023, and Mount Graham Regional Medical Center implemented the pilot version. Over 300 middle school students participated in that program, and that was our pilot program. We just wanted to first test the curriculum, test the evaluation, because we did develop, and we do have pre and post evaluation forms, you know, to evaluate the success of the program. And so we basically wanted just to start with one hospital and see how that goes, so that we can get a chance to come back and do some modification if required. So based on what we learned from the pilot program, our curriculum was then standardized, and evaluation forms were updated based on the feedback we received. After that first pilot program, we also did the train the trainer approach, where Kim Jackson from Game and Fish Department came to this Trauma Program Manager Workshop Group, and she basically gave training to all the trauma program managers on ATV, like, you know, what the curriculum is about. She talked about the curriculum. She talked about how to prevent it, how we can work with the community, how can we educate the students, and you know, basically there were 72 stakeholders in the trainer program, and then in the month of February of 2024 we did that program. So then the trauma manager took this model back to their community and started implementing this educational program to middle schools. And I think we have two till now: Banner Ironwood Medical Center and Mount Graham again implemented in 2024, after again also participated in my pilot program with us and helping with the with improving the program. They again implemented the same middle school, now the revised version, in August 2024. June 2024, Banner Ironwood Medical Center did the program curriculum. And I think total, 272 students were educated. I think Akeem, went to both the events, was there to educate the kids. We have a evaluation where we ask, I think, around 10 to 11 questions. But when there is, we actually, based on the pilot program, we learned is that sometimes there is not time to implement all the 11 questions pre and post the education. So we came up with even the shorter version of the evaluation also. So we have two versions available. If there's time available, then we prefer that, we ask that 11 questions evaluation. But if not, then we have, I think, 5 questions on the evaluation form, which are the main 5 things we should be increasing the awareness about ATV in the crowd. So what we found, what we did in that 2 hospitals, again, Banner Ironwood and Mount Graham, when they implemented the program, one did the short, I think Banner did the long one and Mount Graham did the short one. So I'm going to present you the combined results of these students, but only on the short, because majority did the short version. So what we found, the red is a pre, and then pre-implementation, and this is a post-implementation of the program for middle school kids. So first thing, what the curriculum evaluated was asked what age may not ride an ATV or UTV without helmet. And can you imagine, only 24% of the kids knew about this, that what was the age not to ride ATV without a helmet. Whereas after the curriculum, 58% answered correctly that question. The second question I was to ask where to check the appropriate size of the vehicle, and 60% knew. It jumped to 74% after the training. The third was finding out on ATV and UTVs are designed for off-road use only. When they were asked, it was a yes and no question. Less than half knew that okay, it is only designed for off-road. So they didn't know that ATV. In their mind, they were like, okay, ATV, we can take the ATV on highways or take it on the road and we can drive it too. No, people didn't know that, and that was quite a big jump. We found that, from 46%, 87% then answered correctly that yes, ATV and UTVs are designed for off-road use only. These last two questions, we did see some, again, obviously jump, but they were mainly about what actions are considered reckless behavior, and what is the leading cause of death and injury among OHV operators. That was mainly alcohol and substance abuse. When you have that in the system, it's mainly the leading cause of death. And both the questions, again, we found increase in the knowledge of the middle school. So we have now so far 2 hospitals participated. We are waiting for other hospitals to implement in their communities. We highly encourage you guys, to come forward and take this opportunity to, join us in increasing the awareness at the state level. And Game and Fish Department, Kim Jackson is very passionate about this. She is eager to help. Let's take this opportunity, and when the momentum is there, let's spread the awareness throughout, so that at state level we are increasing this or educating the kids about the ATV. So that is what we are doing it right now. Is there any other questions I can take?
Thank you, Vatsal. That was fantastic. Yeah, so make sure, I know some of your communities are probably more prone to ATV injuries and things like that, but this is definitely something we want to make use of and get out there. So also, this shows how important data is. Because of your guys' data, we're able to recognize trends like an increase in ATV deaths. So thank you, Vatsal, for sharing. And if you guys have any interest, feel free to reach out to me, and I can get you guys in touch with Kim Jackson at Game and Fish, and we'll get you guys set up. So, all right. So I had a question to go over the physical abuse fields. And we go over these often, but there's always new people, and I think there's a little bit of nuance for capturing this. So the first thing I wanted to share is when you're coding the injury code, the ICD-10 code. So this is a screenshot of the ACS guidelines for capturing those. So there's 2 different scenarios that you're going to see. So if there's suspected abuse, you see that there's only going to be 1 code. That'll be the T code. And then you see down here, if there's confirmed abuse, you're going to have 3 codes. So the first code is going to be your T code. So that'll say like physical abuse, or if you look up to this, there's shaken infant syndrome. All the T codes kind of show adult and child abuse. There's different T codes you can use for that. And then the Y code is the perpetrator. So that's the person that is the abuser that you can capture. And then the third code is kind of your regular, was it just a physical assault, or was there a bat? I don't know, just all of those different codes that can kind of show what was used for the abuse. So those are the 2 different scenarios. Any questions on those? Okay. So then these are the different fields that we have. So the first one is report of physical abuse. So these definitions are all ASTR data dictionary. So the first one is: a report of suspected physical abuse was made to law enforcement and or protective services. This includes, but is not limited to, a report of child, elder, spouse, or intimate partner physical abuse. So this needs to be documented in the medical record that there was a report made, and this is a yes or no field. And then this is very similar, investigation of physical abuse. So an investigation by law enforcement and or protective services was initiated because of the suspected physical abuse. This includes, but is not limited to, a report of child, elder, spouse, or intimate partner physical abuse. And then only complete when report of physical abuse is yes. So that's similar to above. And then down here is caregiver at discharge. So the patient was discharged to a caregiver different than the caregiver at admission due to suspected physical abuse. And then you only complete for minors as determined by state local definition, excluding emancipated minors, so less than 18. So any questions on those? And sometimes I think there's different situations that we have questions on if there's gray area. So you can always reach out and we can figure out what the best way to capture that would be. Okay. And then I also had another question about financial fields. So we have, primary payer or primary method of payment, secondary method of payment. So those are easy. There's not really you don't have a hard time finding those, right? But then total hospital charges and total reimbursement. So the question was about reporting on this data. So financial data is to be exported twice for each record, similar to the way other updates are sent to ASTR. The initial data should be sent on the record's regular quarterly due date. All updates should be included with the next quarterly submission. So I recognize that you don't get these numbers right when the patient is discharged. And so leave those, I would leave them blank, because then you know that they're not filled in. And then when you go and we run validations, I know that those are not in yet. This says that you need to then submit it with the next quarter. I know that sometimes that doesn't happen, that it's 6 months out or whatever. So you should be submitting that data whenever it's finalized. That being said, if it's past a year, the data has already been finalized. VOTSL's already working on the annual report, and no changes are made to that. So does that make sense? Does anyone have any questions on that? Okay. And then I also wanted to touch on, we've had a couple of questions at our Q&A session yesterday about uploading financial data in the ESO patient registry. So there's currently not a way to upload the financial data into the ESO patient registry. That being said, that is something that they're working on. That's kind of a build out that will be available in the future. But also on that is it's part of kind of their EHR health record linkage. And so that's something that would be at the hospital level that you would need to be able to link it to your, right now they only have the ability to do it with Epic through Fire, but they're working on getting it with Cerner and Meditech. And then I know that there was some discussion about All Scripts, I believe it was called yesterday. So they are working on having that ability to integrate the financial data from the record. Any questions? Okay. All right. Let's see. So updates and for trauma program managers, this is the same update I shared last Friday, but I wanted to make sure all the registrars were also in the loop. So ADHS is still continuing to evaluate bids from the request for proposal, the RFP that closed in May. So we are not done with that yet. I know that's not what you want to hear, but we will let you know as soon as it's done. I don't want to give you a solid date and then we pass that date, but we're really hopeful that it will be done by the end of the month. I know we've passed dates that we've hoped for in the past, but fingers crossed that we'll have some answers for you soon. And then also, so facilities transitioning to the new ESO registry have been given access to the sandbox environment. Those of you that have been on the Q&A meetings, And just to note, those of you who are still non-web based and aren't transitioning right now haven't been given access because you're not transitioning yet. And then there are a couple facilities that have their own ESO contract that we also haven't given Sandbox access to yet because you're on your own contract and doing those training steps. So but those of you who are a reduced data set that do not submit the full data set, I'm still working on getting you guys access. The reason we haven't given access yet is because the first trainings are all admin trainings and you don't really need to do those. And so we'll get you access for the regular data entry registry type training sessions. Let's see. Yep, we're working on trainings, and then there are weekly office hour meetings. They've been attended very well. So we have them for the full data set on Tuesdays at noon, and then the reduced data set is on Wednesdays at noon. The only reason it's split up is because it is just kind of better to not have a giant group, and it's easier to ask questions in smaller groups. So if you want to attend both, you're more than welcome to attend both. And we've been working with ESO to get the recordings out for those because it's not a Google Meet recording. I can't just share it with you guys. It is a Microsoft Teams link. And so ESO has to go in and kind of enter all of the email addresses. So I've shared the TRUG list so that you guys should get those. And they've been working on the permissions for that. So has anyone gotten those recordings yet? Okay.
I haven't.
You have?
No, I have not.
Have not. Okay. We have another meeting today, so I will make sure and ask ESO about getting those recordings out so you guys can watch those if you're not able to attend. Okay. Any questions on this so far? Okay. So next I wanted to just show you guys if any of you haven't logged in yet to access the training courses, that's the first big step, right? We want to make sure everyone has access to the training courses early so you have plenty of time before we transition over to get very familiar with the registry. So, all right. So this is the link that is shared when you get your login info. So up here is going to be your username. And then down here is a password. The password will be sent to you in an email separate from your username. And then down here is the agency code. It's ESOPR. So that's just, this is just the Sandbox code. So once you get access to the registry itself, it will be your own code for your facility. Okay. Okay, let's see. So note up here just says ESO Trauma Hospital. This is the Sandbox environment. And so what I mean by Sandbox is it's kind of the play environment. All of the data is kind of dummy data. It's not a real environment. It's meant to go in so you can look and get familiar with it. So people can change the name up here. So the other day it was Ohio Hospital. And so if it doesn't say anything about the state of Arizona or your hospital, that's totally fine. You're not in the wrong place. It just can be changed. So these up here are all the different kind of, I guess I would call them modules. So registry is just the data entry. Tracker is the health or the EMS linkage, but you don't need to really worry about that right now. That's not part of it. And then PM is where your admins can go in and grant access to other people. So we started it with at least one admin for each of the full facilities, but a lot of you have multiple admins. You want to be cross-trained, which is perfectly fine, but this is where you go in to add someone else if you want to give them access. And then what I wanted to focus on was right here is learning. So if you click on this, okay, you'll come to this. You don't need to sign in again. Don't try to sign in with your ESO credentials. Just click on ESO customer login. Okay. Oh, it took me to my course I was at. Let's see, hold on. All right. All right, let's get back to the regular. Yeah, there it is. Okay, so this is the main menu that it's going to pull up. So what I would focus on is if you scroll down, you're going to see these 11 different boxes. These are all different training modules. So right here, these steps 1, 2, 3, and 4 are very much admin focused training. So it's talking about how to set up your registry and add people and that kind of thing. So if that's not the role you're going to be in, you don't need to take those trainings. The ones that everyone should be doing are 4 through 8. So these ones are everyone that's going to be doing data entry. Those ones are going to be the courses that you should be taking. And then down here, it gets into performance improvement. So if you are doing performance improvement or you're a PI nurse or something like that, this is solely focused on that. And then in chart validations, this is also one that everyone should be looking at because Trauma 1, you have the validator after. With this program or this platform, it kind of validates as you go, and you'll see them on the side. So this is that'll be new. And then over here is the report running. So there's 2 different report running options. So if you want to do just the basics, there's a basics course, and then there's the beyond basics. So if you won't be running reports at your facility, you don't have to worry about that. If you will be, then that is a great one. Okay, any questions so far? Okay. So right now with the office hour visits that we're doing with ESO every week, we're still kind of going over the admin type trainings. But every week we'll kind of talk about something a little bit new. And another important thing to note is I had sent out there's a Microsoft Forms that you can submit questions to for the office hours. So if you have any questions, ESO's asked that you send those in beforehand so that they can kind of prepare and make the most of our time. It's perfectly fine if you think of a question during the meeting, you can ask it then. It doesn't have to be beforehand. But if you do have a question, you think of it, use those forms. So let's see. Okay. So I think that's all I wanted to share from there. Does anyone questions? Any questions? Okay. All right. So I also sent out the quick links sheet that has links to all of the different trainings. Has everyone has gotten that? I guess a better question is if you haven't gotten that, let me know. Brenda. Okay. Brenda, by handouts and reference material, are you talking about like a user's guide? Or anything, is there anything specific you're looking for? Let me know. Maybe let me know if there's anything specific. There is there's also a user's guide. It's everything that's in the trainings, but in a big manual. So if you're a type of person that wants to read, okay, yes, Brenda, there is. We went over it yesterday in the Q&A, and if I'll make sure and put it in the minutes, or I don't know how to best share that, screenshots, but we can, actually, let's see if I can remember how to get there. Let's see. Okay. So if you go to registry, and then you click on this little question. This question mark down here is great. For those of you that haven't been at the meetings, you can submit feedback down here. So if you can if you think of something like, wow, it would be great if this happened, or if it was laid out differently, or if this was an option, you can submit feedback that way to ESO. So if you click on the little question mark and then you go to resources, let's see. I think he said you need to be, let's do, it's on resources on one of them. I'm learning just like you guys. Okay, maybe it's a question mark on the main. It's under resources. Okay, so online help, more resources. And then registry, I'll send the link to this because I'm going through lots of screens. So yeah, long story short, there is a giant user's guide that you can use that we'll get the link and send it to you. So you don't have to remember all those steps. So yes.
I think Carissa might have accidentally exited the meeting, but I'm sure she'll jump right back on.
Shelly's just going to take over for me. I apologize. I went to scroll over to my PowerPoint and I exited out of the call. So that was great. Let me go ahead and share that again. Okay. So I will send you the link for the user's guide. And then I think there was a hand up. Did anyone else have any questions on that? Okay. All right, so that was all I had. I purposely made this a little bit of shorter meeting. I wanted to have time for questions and the abuse screen, yes. And I know we have a lot of meetings scheduled regularly with trainings, so I wanted to be mindful of your time. Okay, here are the abuse fields. Did you want to see the other? And I'll make sure and send out the PowerPoint so you have this as well. This one, okay. Okay, any other questions? Okay. So we'll just keep working on trainings. I will give you any updates on the RFP that we have. I think that is all that I have for you guys today. Yes, Brenda, I will email out this presentation as well as with all of the minutes and everything that we've gone over. Great. Okay. All right. Thank you guys. We had over 100 people. This is by far the biggest we've had. So, yep. Go ahead, Jody. Okay. All right. Have a good day.